reasons I chose this study was that although this particular serum marker is not available in the clinical setting yet, there are quite a few biomarkers in kidney disease that are not only being studied in veterinary medicine, but are also available as ELISAs already. So I think that it's only a matter of time that we start to have these available to us in the general public in our in-house veterinary testing. So the particular objective of this study was to report on the utility of measuring serum SDMA concentrations in cats for the detection of chronic kidney disease before the diagnosis of conventional serum creatinine. They had two groups of patients. One was a group of cats with chronic kidney disease compared to a group of healthy geriatric cats. You can see the mean age in the chronic kidney disease cats was around 14 years. They were distributed 15 female spayed and 6 male neutered, and an average body weight of 4 kilograms. The healthy geriatric cats were a mean age of 11.7, distribution of 12 female spayed and 9 male neutered, and the mean body weight of those cats was 4.5 kilograms. Oops. Sorry. Okay. So the main results were that the serum SDMA and serum creatinine concentrations were both significantly correlated with GFR. However, the SDMA became increased before serum creatinine, and I was pretty impressed by the range here. It was a mean of 17 months prior to the creatinine actually becoming elevated, which I think would be a great way for us in the clinic to monitor these cats before it's really, in some cases, too late. When we look at the sensitivity and specificity of these two markers, the serum SDMA marker had a higher sensitivity, pretty comparable specificity, and a positive predictive value of 86%. Now, of course, the creatinine has a positive predictive value of 100% because at that time, again, most of those cats have already progressed into a state of chronic kidney disease. The conclusion of this study was that using serum SDMA as a biomarker for chronic kidney disease allows for early detection of chronic kidney disease in cats compared to serum creatinine. This shows a promising biomarker for the early detection of chronic kidney disease in cats, and it may be desirable in initiating renoprotective interventions. And the main ones I think that we have in veterinary practice today are nutritional and dietary modification. So again, I think that this is going to be a new marker that we may see more of, and certainly there are people working right now to make this a tabletop test for us to have available in our clinic.
I was curious, when the authors talk about the specificity and sensitivity and positive predictive value of this new test, what were they using as the gold standard to determine whether or not the cat actually had chronic kidney disease over time?
They were actually using creatinine as the main marker, and I apologize, I don't remember the exact values that they had, but I can definitely pull that up for you. But there was definitely a few exclusion criteria, no concurrent disease processes, and I believe that the creatinine was really the main marker that they were comparing to. So it was just taking creatinine as we know it and comparing this biomarker to see if it was better, worse, or the same. Just pulling it up.
Actually, they did have GFR data on these cats.
Thank you. I was just looking to see if we had it.
Yeah. So these cats were enrolled in a nutritional study, and so they had like a year and a half, 2 years of data, and so they had, I think, 3 time points of GFR throughout the study.
You did that by like creatinine clearance?
I think inulin or iohexol. I can't remember.
All right, cool. Okay, great. Because the reason I ask is that if they're going to say that SDMA has 100% sensitivity, they can't say that if they're using SDMA as the as their only marker. They needed something else to compare it to actually use as their gold standard. So I'm glad they did creatinine clearance. I apologize if you said that somewhere in there. I may have missed it.
No, it's in our original slide set, but we took it out just to shorten everything up for this discussion.
Sure. Okay, cool. That sounds promising. So in the conclusions, are the authors recommending that this may someday be a screening test, basically?
Yeah, absolutely. There's a couple other markers that are out already as ELISA tests, although they're not clinically available at this time. So I think that this may be another one where we could have it available as a lab test. I think it'd be great if it was something we could add right to our chemistry analyzers, but I don't know if the capability of adding that on.
Yeah, sure. Cool. Well, thanks, Melissa.
Yeah, no problem. Thanks for joining us.